Everyone, welcome. Thank you so much for being here. We'll give everyone a little bit of time to arrive, regardless of where you're joining from. Maybe you're at the hospital, the clinic, home. Really appreciate you taking time to join Pickles Group. And if you're in a position to safely share where you're joining from, we would love to hear from you. This is our first ever Pickles Group Clinician 2.0 webinar, and this has really grown out of the demand from all of you at our What About the Kids webinar that we've done several times continuously. The question that we're getting is, how do you support kids during incurable or end stage cancers? And so we've been working really hard on this content and this information, and it comes at a perfect time because as an organization, we are ready to welcome families who are navigating kids who have lost a parent to cancer. So our youth program enrollment is open right now for the fall. September 5th is the deadline. And so if you are thinking about or caring for or holding space for a family who's not only navigating cancer, but also end of life, this is really what this discussion is all about. And we have jars, pickles jars for kids who are in that shared experience to connect with other kids who get what it's like, not only to navigate a parent's cancer experience, but also loss. So welcome, thank you for being here. And we will start by just hearing, sorry, I just see a message really quick. I'm just going to make sure. I know there's the AI notes. I was just checking in about that. So I am going to just get to know you all first. So we have a little poll, and I just want to hear kind of who's in the room. I'm going to go ahead and share that right now. If you want to do that, if you're able to do so safely. I know some of you are in meeting rooms together, which we love. The more the merrier. But if you want to answer the 3 questions that you see on your screen, that will help me to know kind of where you're joining from, how comfortable you're feeling, and what type of role you work in. So I'll give everyone some time to answer the questions. All right, just a few more minutes. We're at about 75% of the folks who are here. Thank you for answering the questions. All right, just a few more seconds, and then I'll end the poll and kind of see where everyone is feeling today and where you're coming from. All right, so a lot of you are working in outpatient clinics. I see that there are some working in inpatient and other settings as well, but more than 50% in an outpatient clinic. And a lot of social workers here, so thank you so much for being here. We've loved having a relationship with AOSW and meeting some of you at those conferences, so thank you. And we've got some child life specialists, therapists, nurses, and a physician, amazing. And then a lot of other roles. So if you want to share what type of space you're working in, we'd love to hear from you. We're just so eager to connect with so many professionals who are really on the ground working with parents who are asking these hard questions about how to support their kids. In terms of how comfortable everyone's feeling, majority is okay, could be better. And I think that makes a lot of sense. You are probably navigating difficult conversations every day with your patients who may have kids at home. And I'm sure using a lot of tools that you already bring and wanting to be here to learn more. And so I hope that I can really add to your toolbox. And then I'm really excited to see that there are many feeling very comfortable and some who need some help. So we're all in this together at Pickles Group. We're all about building communities. And so we want to really work together and share resources and knowledge as well. A little bit about me and where I'm coming from. So I'm Kelsey Mora. I'm the Chief Clinical Officer for Pickles Group. And just to help understand kind of my background and how I come to this work. So I am a former hospital-based child life specialist. And so I know there are some child life specialists here. For those of you who maybe aren't as familiar with child life is often found in pediatric hospitals. So where kids are the patient. And often child life specialists are being called on to come support children of adult patients. Now, that is an area that is not as readily available for child life support. And so there's definitely been a need and a gap to really fill for families who are asking, how do I prepare my kids? What do I tell my kids? What about my kids? And so Pickles is really trying to do just that. I'm also a private practice clinician, and I'm the author and the creator of the DOT method, which is an activity that we use at Pickles Group to help explain cancer to kids. So before I get started in the content, I really want to ground us all in this work and really help you think about some of your own patients who are probably asking really hard questions. So, of course, the first is like, what about my kids? And that's a common one that you might hear at multiple points in the cancer experience. And perhaps when it comes to these advanced stage, end of life, incurable cancer conversations, parents may get to a place where they have no choice but to involve their kids. We at Pickles Group really encourage those early conversations, but we recognize that every parent and caregiver has different comfort levels and that every cancer experience moves at a really different pace. But we know that when things get really hard and complicated, and when end of life enters the conversation, it can be really hard to avoid, even though that might be our instinct from coming from a place of protecting kids from difficult information. Often parents want to know, how am I going to tell my kids? This is hard enough for me to understand. How can I possibly begin to explain this to a 3 or a 13-year-old? I don't want them to be scared. So talking about cancer is scary. Talking about the potential for death and dying can be really scary. And we know that kids are often more scared by what they don't understand. And we hear from a lot of social workers and nurses, like many of you who are on the call, that kids know. They're very curious, and they pick up on what's happening around them. And so we really want to help parents and caregivers understand that. I have to be strong for my kids. This is a really big one. And strength can look a lot of different ways. And so I really want to break down, what does being strong really mean? And does it actually mean not showing emotion? Does it mean not talking to kids? And we're going to challenge that a little bit today. And then that last one, I can't let them see me upset. This is a common question that I get as a clinician is it okay to cry in front of my kids? And so we're going to talk a little bit about the value of showing emotion as well as the limit to showing emotion. So in terms of what I'll cover today, so for those of you who have attended our first clinician webinar, this is going to follow a really similar pattern to keep things really consistent and familiar for you. So we will really lead with our 3 main pillars here at Pickles Group. We'll lead with our 3 main tips at Pickles Group, but we're going to apply it to a different conversation and a different topic. So we'll talk about developmental responses by age. We'll hope that you can master tips to guide your patients who are really wanting to prepare their kids for these end of life conversations. We'll talk about supporting the whole family at end of life. And then, of course, I want to help you identify really how and when to use resources, both internal and external. I want you all to walk away feeling like you really understand what we can offer at Pickles Group and how we can work together. So many of you, I think, are returning because we already have an existing relationship. But for those of you who might be new to our organization, we are focused on providing free peer-to-peer support and resources for kids and teens impacted by their parent or guardian's cancer. And we do that in an evidence-based way with 3 main pillars to our work. So that first pillar is honest and age-appropriate information. We really believe in having those open and honest conversations with kids. And we have a really robust peer leadership program, which are teens who have lived this experience, who are now working alongside us to help the younger and the newer kids to Pickles Group. And hearing them speak from their own experience of what honest and age-appropriate information meant for them and has done for them really demonstrates the importance. And we've gotten to hear from a lot of them. We'll have some new projects releasing in the fall that we're excited for you to hear directly from our kids as well. Coping skills. So another thing we heard, we just had a really beautiful evening of gratitude here in Chicago last night. And what we heard from a parent who's navigated metastatic breast cancer for 11 years with 2 young girls is that Pickles Group has really helped provide and establish coping skills that are not just helpful for the cancer and the grief, but everyday life. And last but not least, we also believe in peer connection, which is why we are so focused on these small groups of kids, these closed groups where kids get to know the same group of kids over time to really develop those lasting relationships. So we'll start with talking a little bit more about developmental responses. So While our group programming is really designed for first through 12th graders, we recognize that families may have kids that span the lifespan. And so I want to talk a little bit about infants and toddlers as well, because we are not forgetting about them. We want to make sure parents know how to talk to those little ones. And when a family can approach these conversations with the whole group of children, when there are multiple children in a family, that can be so helpful. And so, of course, infants and toddlers have very little concept of death, but they do sense the changes and are aware of the behaviors around them. So they may pick up on their parent looking different or having different abilities. They may wonder why their parent is not around, or why their parent can't hold them, or is not talking as much, or maybe even using a feeding tube. So they're noticing those changes and how it affects them. They might be really sensitive to the feelings around them. A lot of people maybe being sad, maybe a lot of family members coming to stay at the house or to visit the house, people dropping off meals or checking in. And so just sensing that change in the environment. And they may show that through more tears or more irritability. It may mean that their normal routine is disrupted as well. And certainly the relationships that they're developing. Preschoolers have limited understanding about what death means. So they're not really able to fully understand the finality of death and dying, the permanence. They really see death as temporary. You see that maybe even when you think about cartoons, a lot of times the character may die and return to life and sustain an injury. I'm thinking of like the Tom and Jerry of the older era, and so preschoolers don't really understand that that's permanent. And I think about, even before families are facing an end of life situation, I know as a parent to young children, I'm often talking to my kids about a dead worm outside, because death really is more natural than we think. But as a society, it feels really hard and uncomfortable to talk about. And when we start those really natural conversations early, it can make these really intense, serious conversations a little bit more familiar. And so just really thinking about that, even preschoolers are facing death and dying often. They may not understand exactly what's happening. A lot of the Disney movies have death and dying in as well. Coco, Moana, and so really thinking about those experiences. They also have a lot of magic thinking, and they may have concerns related to separation. So when they're noticing that something is changing with a parent, or maybe a parent is dying or has died, they may have separation challenges even with a surviving caregiver. And so that's really normal for that age group. They struggle sometimes to separate at the start of a school day. And so that can be complicated by grief and loss and death and dying. Elementary age. So this is really a pivotal time. Child development research and education really shows that around 6 or 7 is when kids start to be able to understand the more finality and permanence of death and dying, as well as the universality of death and dying. So if you think about a preschooler, I was once working with a young child who saw their dad's car in the garage, and they thought their dad had returned home after he had died, where at elementary age child is more capable of making that distinction, but they still might have misinformation. So they're trying to make sense of something that's really confusing and complicated. And they're also trying to think about how loss might affect their life. And we'll talk about ways to support these ages. I'm just trying to give the foundation of what these age groups are thinking about. And then last but not least, teenagers. So certainly they understand death as permanent, but they might be really curious about the process. So teenagers might have more questions about what happens with the body and memorial services, and may have some opinions about how they want their parents' end of life to look. And some of those opinions may or may not be able to be a choice or happen, but certainly hearing what's important to them can be really helpful. And it might inform some decisions that a family might make at end of life, which we're going to talk about as well. They're also trying to figure out how to function in the world with their studies and their friends and their peer groups, as well as how to express their emotions. And so this is a really important age that is also sometimes forgotten, because we assume that they can handle and know more than, and they actually do need a lot of support. For those of you who are familiar with our Family Cancer Support Kit, we actually have a glossary of terms, and we break down cancer terms using child-friendly language. So I wanted to do that for some of these end-of-life incurable cancer topics. And so I'll start with hospice. And so kids, it can be really helpful to help them think about what hospice is when a parent is getting ready to transition their type of care. And so, really focusing on hospice as a different type of care. It's focusing less on curative treatment. So, it's not working on making the cancer better or getting rid of the cancer cells, but it is working on helping a parent be as comfortable as possible and to help the whole family have really meaningful time and memories together. So, treating pain or building comfort. And hospice can look a lot of different ways. Sometimes it's in a hospital, sometimes it's at home, sometimes it's at a facility. And I get a lot of questions from parents about what should we be thinking about when it comes to our children being present for and witnessing some of these end of life treatments. And so, being able to help kids understand that while the medicine might not be working and we can't get rid of the cancer, we can still care for their parent, and it changes the focus. I often talk about when we start talking about dying, we can also talk about living in a very different way. One of our teenage peer leaders who lost his dad to brain cancer talked about how hope continued to shift and change. And that's something that we'll be incorporating into our new pickles jars curriculum, is really helping kids think about maybe in the beginning, I'm hoping for my parent to get better. And then I'm hoping to have really quality time with them. And maybe now I'm hoping to really keep their memory alive and stay connected with them. So hope doesn't end, it shifts and changes. And that's something we really want to teach our youth. Legacy building and memory making is a really common child life practice, and it's something that can be really helpful at end of life, not only for kids but also parents. And so, what that is helping parents, leave a legacy, helping kids build memories, and those can be tangible. It could be art projects, it could also be recordings, it could be photos, videos, but it's really intended to help kids have those lasting memories that they can hold on to. I've worked with kids who have a teddy bear made out of their parents' shirt, thumbprint necklaces, picture frames. There are a lot of ways to create those meaningful memories. It could also be, thinking about how you want to spend your time together at end of life. So when kids understand that a parent is dying or that a parent has an incurable cancer, they can start thinking about what's really important to them. And I know a lot of the families we've worked with have had really meaningful memories around going to the beach or watching sunsets, and sometimes the things they really want to do might not be possible depending on their parents' condition, but working with parents to figure out a way to make that possible. I had a family that really wanted to travel and that wasn't possible, but what they did is they thought about where they wanted to travel, and they made it happen at home. So they ate that type of food and they made those types of art projects, and they really brought that country to their home. And so thinking about how to creatively make those memories, even if it has to look a little bit different. Death and dying is a really important topic. Our instincts are to maybe talk about passing away or perhaps, going to heaven, depending on one's faith tradition and beliefs of afterlife. And it's really important for kids developmentally to hear that death and dying is when the body stops working. Somebody is no longer living. It is okay to use euphemisms after a child can understand those concrete terms, but we want to explain that if a parent is going to die, that means that eventually their body will stop working. And some kids may need more information. They may need to know that that means their heart will stop beating and their brain will stop thinking and their body won't hurt. But it's really important to clarify that their body stops working and not just assume that kids understand what passed away means, because it's not so clear. Funerals and memorial services, of course, there are a lot of different ways to celebrate and honor end of life. And so those events are really going to depend on one's faith, tradition, and value system, but there are a lot of ways to involve kids in those processes. This is a question I get a lot. So for end of life, if we're talking about a parent who has died, parents, there's a lot of mini conversations, just like throughout cancer, there's a lot of bite-sized conversations. This is true for incurable cancer and end of life as well. And the more open and transparent a family is, they may be having some of these conversations early on, or they may happen after a loss, but certainly it can be really hard to think about how to explain cremation or burial to a child. And so really helping kids understand that it's that when someone dies and their body stops working, there are decisions around how to handle their body. And so cremation is the process of making their body hot until it turns into an ash or powder that can be saved or spread. Burial is the process of burying a body in the ground and creating a resting place to visit. Of course, there are a lot of other ways to honor and handle a body after someone has died, but those are some ways to think about how to explain that to a child, because those certain words may be really startling to a child. And so that can soften the information while still making it honest. In terms of what the research shows, so many parents think they're protecting their child by not telling them, which is really natural and it's such a loving decision. And what we found and what the research shows is that children actually have better outcomes when they are prepared. So this talk is called "How to Prepare the Kids," and often kids will say like, "I'm so glad I knew. I'm so glad I understood. I'm glad I had the chance." So even when parents do want to talk to their kids, they often don't know how. And that's where all of you come in and we come in as working together to come alongside these parents and really give them the tools to know how to talk to their children about these things. We also know and hear that many oncology healthcare workers feel unprepared to guide their patients. Even, social workers like many of yourself, we've heard, I know what to say to adults, but I don't really know what to say to kids. I don't know what to tell my adults to say to their kids because it's a different approach and requires different language. And I know there are people on the call who indicated feeling really comfortable. And so I'm glad that you are probably the people who are kind of raising your hand and coming alongside these parents because you want to. And it's also sometimes hard to know what to say. So we do have a family cancer support kit, which many of you are familiar with. This is not focused on incurable cancer per se. It's more focused on that general cancer experience. But why I want to highlight that is because that can help with those early conversations to make some of the advanced care conversations more familiar for kids. It's really can be hard and overwhelming if a parent is starting from the beginning when they're having to have end of life or incurable cancer conversations. And we really want to apply the three main tips to these conversations. So we talk about sharing information, sharing expectations, and sharing feelings. And so I'm going to go into each of those in more detail. And this is the approach that probably sounds familiar to many of you who have attended other webinars with us, but I'm going to apply those to these incurable cancer and end of life conversations. So in terms of sharing information, you may have a parent who's asking, how do I tell the kids? And so similar to cancer care conversations, you may be thinking about where, when, and who should I do that with? And so it can be really important to talk to parents about who can have that conversation with you. Is there a co-parent? Is there a family member? Is there a friend? It can feel a lot more supportive to not have to have those conversations alone. Also helping parents think about the best time, typically not right before bed, not when they're very busy and running between a bunch of scheduled activities. Also making sure kids are well fed and well rested just to give them the best outcomes, and also helping parents know, a lot of times parents worry about how their kids will respond, and they may worry that they did something wrong if their kid has a response that they weren't expecting. But in my experience, I will tell you that kids all respond very differently and it's all very normal. Some kids have a lot of questions and some kids need some time to sit with the information. What can help kids with these conversations is actually giving a warning. So saying something like, I have something difficult or important to tell you, helping parents think about, I have an update. And what that does is it actually helps kids' nervous systems pre-regulate so that whatever's coming next, I know that it's going to be a different type of conversation. And then what do I tell the kids? So we've talked a little bit about some of the terms, but certainly sharing an age-appropriate version of the truth, it can be really helpful to start with what a kid already knows. So a parent might be saying something like, remember how daddy was getting that chemotherapy to get rid of their cancer cells? Well, we have some sad news. We got an update from the doctor and that medicine's not working anymore. It's not getting rid of the cancer cells and there's no more medicines. And so that means that the cancer will continue to spread and daddy's body will eventually stop working and he will die, right? So starting with what they do know and then building on it from there. So you might be asking your parenting patient, what do your kids already know? And that can help you know where to begin and what to help them with. It can also be really helpful to have parents say something like what we know or what the doctors are telling us so that kids aren't feeling like it's anyone's fault. It's really the information. The doctor's job is to examine their body and use the science to understand what's going on and what's available. And the parent is really just delivering that news to their child. Some common terms might be hospice, dying, died, again, trying to use really concrete language. And again, these conversations build over time. So when parents are asking, what about my kids? You're really encouraging them to open the lines of communication. Just like, your natural instincts might be to protect your child and not want to talk about this, but kids are sometimes more scared by what they don't understand. And if you protect them and don't talk about it, they might protect you and not talk about it. And that's not what you want, right? You want to have open conversations with your child. Parents are like, I don't want this to disrupt their childhood. I want them to be okay. And will they be okay? And we really know and believe that when kids are provided with honest information and adequately prepared, their outcomes are actually a lot better. Follow a kid's lead. So parents sometimes follow a script. They want to get a lot out. Just building that trust, building that comfort, and seeing what kids ask, what they bring. That being said, sometimes parents will wonder, like, should I wait until my kids ask questions? But if kids are sensing that this is not something we're talking about, they might not know to ask those questions. So it may require a parent actually opening up the conversation and then waiting for a child's questions. And that, that guidance can kind of then build on itself, and parents can update them when they need to, or kids can ask when they have more questions. In terms of sharing expectations, so it can be really helpful to prepare kids for what changes may happen. So if a parent is transitioning to hospice, what is that going to look like? Where is that going to take place? If a parent is changing treatment, maybe they're going for a clinical trial and it requires them to travel to another state. So really preparing kids for those changes and those transitions, helping them understand what's going to be different, what will be the same, maybe some of the unknowns. We found out that dad's medicine's not working anymore. We're going to try a new treatment. We don't know exactly what the side effects are going to look like. We're going to learn more. As soon as we know, we'll update you. What we do know is that it's going to require us to travel to the city for a full day every 2 weeks or something like that. And so helping them think about, what that might look like and who might take care of them. There may be some unexpected, but when kids know what to expect, they also can cope better with the unexpected because they have a baseline for understanding what's going on. There can be differences in how siblings handle things. And so one question I get a lot is, should we talk to kids all at once? I do often recommend having a family conversation first and then having one-to-one conversations later. That can be helpful so that the siblings feel like they're all hearing the same information, even if it's maybe geared toward the youngest in the family. And then a parent can have a one-to-one conversation later with an older child who maybe needs more. That also helps an older sibling maybe not feel responsible for withholding something from a younger sibling. It just creates some commonality with the family. That being said, of course, parents know their kids and families best, so they may determine that if there's a big age gap or maybe developmental differences, that having those individual conversations could be better. So that can look a lot of different ways, and wanting to really help kids gain a sense of control. Obviously, throughout cancer, but certainly with incurable cancer, metastatic cancer, these ongoing, advanced, complex conversations, kids really need to feel a sense of stability when things are really chaotic and unpredictable and uncertain. I do a lot of nervous system work, in my clinical work, and when we're navigating these types of conditions, there's a lot of on edge feeling. What's going to happen next? What's the scan going to show every 3 months? How's the medicine going to go? Is the medicine going to keep working? And kids start to feel that too. And so we do need to have some grounding to make that time easier. So helping parents think about providing their kid with choices, that can also help with decision making around end of life decisions. Maybe the more they understand, what's important to a child, or maybe what they're scared about, they can maybe even make some decisions about that. That being said, I want parents to also be able to make decisions that are best for them. And so if a parent is really adamant and comfortable about, let's say, dying at home, and then it can be really not about protecting or shielding kids from that, but preparing them for that. And also creating some stability around having maybe a normal school day and then having dedicated time. I often talk about how it's not always about quantity of time, how much a child is spending with their parent, but how that time is spent. And so really trying to be intentional with that time. And again, just helping parents remember, you can't control the situation, but you can control how supported your kids feel. And that can give your patients a sense of control as well. Like, this is really hard. This stinks. It's not what you were expecting. And something you can do really well right now is support your children. And that matters a lot, especially for the patient who is thinking about not being there for their child's full life, and wanting to really prepare their child, not only for this time, but for beyond. Of course, you're probably sitting with a lot of patients who have a lot of what if questions. And so you're trying to balance that hope with their uncertainty as well. And the more work that you do with your patients around those challenges, the more that trickle down effect happens for their kids too. If parents are are, really working through their own uncertainties and worries, that can help kids as well. And to just taking things one step at a time and helping them identify their support system so that kids can see, and know who's going to be there for them and what to expect as well. Last but not least for these three tips, and then we'll pivot to some other information, is sharing feelings. So we actually heard from one of our board members at this event last night as well, who had a lived experience of being just 3 years old when his own mom died from breast cancer. And his dad really struggled to share feelings. And he shared about one moment where his dad did open up with feelings, and how much that changed his experience. And he really needed that. He really needed a parent to show their feelings. And so when a parent says, I have to be strong for my kids, you might ask them, like, what does being strong really mean? Because being strong can actually be an opportunity to show kids that all feelings are okay, and to actually show kids how to navigate really hard things. Because, like I said earlier, that is a transferable skill. And we really are seeing many thriving kids in Pickle's group because they're having this opportunity to share feelings and practice coping skills, and parents are learning how to do that with them. When parents say, I can't let them see me upset, of course, we want to normalize those feelings. Like, it's really hard to cry in front of your kid. It's really hard to feel upset, and it's so natural. And the more that parents can identify their own coping skills and support system, again, that's modeling for kids to see, oh, my parent is having a hard day, and here's how they're dealing with it, and I can learn from that. And then, of course, parents, I don't want them to be scared, and really helping parents understand that kids are often more scared by what they don't understand, and you can be their most trusted adult and help them understand what's happening. Why is dad's appearance changing? Why are there doctors and nurses showing up at our house? Why is there more medical equipment? Why isn't he eating anymore? All of those questions can be really scary when they don't understand why it's happening. And so if they feel trusting of your information, they know that they can come to you with questions, it's going to really help. Focusing on support over solutions, parents naturally want to fix things, and you can help remind them that this is really not something we can fix. Like, this is really hard. There's no solutions here, but there is a lot of support that can help. This is from the Luna Network, which is one of the resources that we have listed on our website that we recommend for end of life and grief resources. And these are 10 things that grieving children want you to know. So that could be what they want their parents to know, what they want clinicians to know, is they want to be told the truth, and they really look to adults as a role model for grief. They want to talk about their person. That's a really important one. A lot of kids in our program, they want people to know that it's okay to talk about their dad and to keep talking about their dad. They often express their emotions through play and maybe even behaviors. So being kind of curious about what's going on and what's behind that. It is really natural for young kids to play out death and dying and funerals through play. And so it can be alarming to witness or to hear, but it is really natural. It's how they make sense of the world. Sometimes children actually really need to know, like, who's going to take care of me when you die? And that can be a hard but important conversation for adults to have with their kids, especially older kids. They benefit from being included in rituals, in end of life, having a choice. There's so much value in kids maybe decorating their parents' hospice room, or bringing, artwork, or picking out a blanket or a stuffed animal, and really contributing to that comfort. Maybe picking out songs or photos, decorating a picture frame, like I mentioned earlier. Those things can be really helpful. Reading books together, having ways to spend time together. Children also really need to feel safe. And so reminding them that, like, this is really hard and they might not feel okay, but they are safe. Like, what's happening is safe, even though it's hard. They also really need to be taught coping strategies, and that's a big thing that we do at Pickles Group. And last but not least, they really do need their adults to take care of themselves. And so that's such an important role that you all play, is helping adults take care of themselves, so that, really reframing for adults, like, taking care of yourself is actually taking care of your kids, because it makes you a better parent. The kids that we see are dealing with two main types of loss: and ambiguous loss. So maybe a parent who has changed abilities, they haven't died yet, but things are really different. Grieving what life should look like, grieving, being able to plan, predict, relate to other kids. And then, of course, there's anticipatory grief. So for these these ongoing, advanced, and complex cancers, there's a lot of anticipatory grief. We know that something is coming. We don't know when. That could be years, that could be months, that could be weeks. But like I shared earlier, our 11-year metastatic breast cancer survivor who gave a speech last night with her two young girls, like they're having these hard conversations and they're also living everyday life in between. And every day is a gift, but they're also very aware of the reality of her disease. And so that and she's really proud to share that her girls are thriving as a result of what how they've handled these conversations. So of course, the stages of grief are a bit outdated. Not everything is so linear, and so helping parents and adults and kids really understand that you might expect to feel these things in this order, but what you're actually going to get is probably a lot messier of a version of that. It's not linear. It's not the same for everybody. Everyone has their own coping style, and the whole family may need really different things, and that's okay. This model is also often missing anxiety and worry. Sometimes kids have trouble with concentration. They might feel distracted. A lot of kids tell me it can be hard to be at school when a parent is nearing end of life, at home or in the hospital or in a facility. And so again, that quality over quantity, it's really important that you're a kid and that you have your responsibilities, but being able to connect with your parent at the end of the day. Some kids are scared. They may not want to spend a lot of time in the room if their parent is actively dying or changing. And so finding ways for them to feel connected if they don't feel safe or comfortable in the space, that's an okay choice to make. The important thing is that kids feel like they had that choice. I've worked with kids many years out, and we talk about how you made the choice that was right for you in that moment, even if it meant not visiting the hospital and saying goodbye. And at Pickles Group, we really focus on these three main ways of supporting kids. So again, helping your adults, their kids know that we don't always have solutions, but we can provide support. And the way that we do that is we listen first. We always validate. Like, yes, what you're experiencing and feeling is really valid. You can say that to your patients. I'm sure you already do. They can say that to their kids. Because once we do that, then we can start reassuring. We can navigate. We can problem solve. We can explore, but we have to validate the feeling first. We have to know that whatever we're thinking or feeling is okay before we can start really working through it. So I'm going to pivot into these getting ready for children at end of life. And so that, what about my kids? I don't want to leave them out of this conversation. So I kind of have a few steps on the screen. So this would be like for any conversation, again, really assessing their understanding first, giving that warning. So, what do they already understand? You might even ask, like, what's your understanding of what's going on with dad? And that will help you know where they need to start and pick up. Maybe they're like, oh, he's like working really hard to get better and he's probably going to get better and not need medicine anymore. If that's really far from the truth, that helps you know, oh, we have a lot to talk about here. Or a kid might surprise a parent and say, like, I'm pretty sure the cancer is really serious and that they might die. And you'll be like, oh, okay, yeah, that's actually a lot about what's going on. And so it helps you know, like, where are they at and where do we need to go? Giving them a warning. I have something important to talk to you about. Building on what they already know. So wherever they might be, remember we talked about this. Well, I have an update. Giving an age appropriate version of the truth. So that can be a really important takeaway. Is a lot of times parents might get caught up in the details, and you don't need a lot of details. It's okay to focus just on what's happening right now, what they need to know, and then you can build on it from there and follow their lead. If we start with what kids need to know, we will often get to what they want to know, because they'll know I can ask a question if I need to. I don't have to if I don't want to. I could say I want to play and I've had enough. And that will help us know, like, okay, that's what they need right now, and being really flexible with that. In terms of considering a visit for young children, so many of you said outpatient settings. So you may be at a clinic, you may be at an infusion center, maybe you're at a hospice facility. So really thinking about what would that look like for kids to actually come and visit a parent. It can be extremely valuable for kids to have that opportunity. It may not for every child, but if a child is going to come visit a parent, especially a parent at end of life, this again, how to prepare the kids. We want to start with preparing a child and thinking about those sensory and what I call sequential information. So the sensory information is, what am I going to see? What am I going to hear? What am I going to smell? Maybe, what's going to be happening there? What am I going to witness? And the sequential information might be what's the order that things are going to happen. So we'll get to a waiting room, then we'll click the buzzer. So figuring out, what is that going to look like? What can I expect? Or maybe, at a hospice facility, maybe explaining, it actually really looks a lot like a home environment. There's just a lot of people there and it's not our home. So, dad is in a normal bed and it has, some hospital equipment, but there's a lot of cozy blankets. So really helping them understand what they're going to see. Again, giving them those choices. You want to make a card to bring with you. Should we pick something out to show dad? And giving them those choices and then following their lead. Again, if a child is really scared, it's okay to listen to that and not have as long of a visit or as detailed of a visit, or maybe they come, but they wait in the waiting room in color. That's okay. And so really navigating what kids need. Some kids will be really eager and want to enter the room, and then they get in there and they find it overwhelming and want to step out. Sometimes kids are hesitant and then are right up at the bedside. And so really understanding that kids may end up needing different things. For staff, it is so important to prepare the environment. And so as a former child life specialist in the hospital, a lot of times I was working with the bedside nurse. And of course, that was in more of a acute hospital setting, but calling ahead, making sure it was a good time for patient care, softening the environment with, the blankets and turning down the buzzers and beeps and really having close communication and coordination with the medical staff. That can look a lot of different ways in a lot of different settings, in a home setting as well. So depending on where a parent is and what's happening, really thinking about what they're going to see and hear and how to soften that environment as much as possible and prepare them for it. So you might be working with a team to create that plan, and helping parents or caregivers think through that as well. Okay, so last but not least, I want to really focus on the resources. We've talked a lot about what to do, what to think about, how to navigate these conversations and these moments with families. And I definitely want to make sure we have time for questions because I know I've covered a lot. But in terms of resources, of course, there are many of you here from robust healthcare institutions that have a lot of existing resources. So of course, identifying, what resources already exist within your system. Maybe you do have a child life program, or maybe you are the social worker whose job is to really sit with families during these hard moments. And so figuring out like, who is the person and how do we navigate that? Or maybe there's mission and spiritual care and everyone's working together. Maybe there are other resources. So really identifying that. In terms of what Pickles Group can provide, of course, we have our support kit for some of those cancer conversations. We have a lot of webinars like this one. And so we're also building a lot more content on our social media and our YouTube channel. So we will continue to be having short clips, long clips, content that's really focused on helping you as the clinician and parents navigate these moments with their kids. We have a Phone a Pickles Friends series where we answer questions that our real Pickles Group kids are asking. And I see that Alana, our Director of Communications and Marketing, is dropping some links in the chat for you all to have, but you will also get a follow-up email with all of this. We also have a list on our website of recommended books and other resources and partner organizations that are helpful, including grief and end of life books and organizations. I highlighted a few specific end-of-life grief and loss partners here, the National Alliance for Grieving Children, the Dougie Center, Aluna Network, and Inheritance of Hope, to name a few. We, in November, I know that feels a little far away, but we are doing a collaborative webinar and parent and family panel that really leans into this part of the cancer experience, the end-of-life conversation, and you'll get to hear from parents who have had these difficult conversations with their kids, and we'll be partnering with some really amazing organizations to share about some of the resources that are available. Last but not least, of course, self-care is a buzzword, but I always like to include it because it's so much more than that. And we know that we need to take care of ourselves in order to take care of others. So I have two main quotes that I always like to leave people with, whether you are new to your role or you're more senior, you've been doing this a long time. It's always a good reminder that self-care actually requires self-compassion. It requires you saying like, I need to take care of myself, right? Or I need to ask for help, and being able to check in with yourself and give yourself that grace. And then of course, trusting that you're where you're needed most. I remember as a former PICU child life specialist, I would have 16 to 20 beds, and I might spend hours with one family if a child was dying, or I was having these end of life conversations, or a sibling was visiting, which can be really similar to that in the adult setting. And so keeping in mind that it can be really time consuming, and it's valuable, it's time well spent, but it can feel hard when you're balancing a lot of other responsibilities, and sometimes trusting that you're where you're needed most might even be with your own family. And so, I know it's easier said than done, especially in settings that demand a lot from you, but I think it's really important to remember, and it's something that has helped sustain me in this work. Now, arguably the most important slide on this entire deck today is making sure that you know that we have a place for your families to connect with other families. We've talked about kids needing honest and age appropriate conversation, and needing coping skills, and needing peer connection. And we have designed and created just that. So for kids ages 6 through 18, all are welcome. We have our new and improved program. I was saying last night at this event, I know I keep referencing it, it's just very timely. I was saying like that it's a new flavor of pickles, and it really is. We have this Connect Over Cancer program for kids who are navigating a parent's cancer, and it is a 5-week intense social emotional learning snippet, and families are often asking what's next. And so we've developed it. They're called pickles jars. We have it for kids facing a parent's advanced or complex or ongoing cancer experience, as well as kids who have lost a parent to cancer. So if all of you can do me a favor and pause and think of one family that you are working with or you have worked with, and refer them to pickles groups so that we can serve more kids. The quality of our program is so much more when there are many kids in the group, because the whole point is peer-to-peer support and connection. And so we have really designed a model that works so well when there are many kids connecting. We can put kids in same age groups, having more similar experiences. And we heard from a parent who shared, unfortunately, his wife just died, and he's going to be moving into that bereavement focused jar, and he talked about how it was so helpful to know to expect the same kids every month. It started to feel like a family. So that's available to you, as well as many other webinars coming up. We have a Spanish language one in September, a breast cancer webinar in October, and as I mentioned, the end stage cancer conversation in November with a panel. So most importantly, please refer a family. You are seeing the links in the chat right now, and registration closes on September 5th. So you have multiple weeks to make sure that every family who needs this support has access to it. And everything that we do is free. So please refer a family. All right. I have several minutes to hear from you. So if there are questions or thoughts, I will close out my screen to make sure that I can see anyone who wants to be seen, and I can take questions through the chat or off mic. And would love to hear from you all if you have any questions or concerns about our program or about the content.
I do. Hi, Cameron.
Hi.
Hi, it's Susan. I work at Nancy Marks Cancer Wellness Center. We're a free cancer wellness center in Long Island, New York. And I actually, we have a new member who's coming in who has 3 children, 11-year-old twins, and then 8.5. What's the best way to start the process? Is it that we give, would give this person the website, and then they would, or I'd apply for the kit? Like, how do they start with this registration process? They just call, or they go online?
Yeah, great question. You actually named many different routes. So I think I'll say whichever ends up it being the easiest for you, but a couple different ways. They can call. We have a call center. We also have a referral form. So the link here, I'll read, it says refer a family. You can click that with their permission. You can actually fill out their information, and then we'll do the following up. So we'll take over for you from there. We'll reach out. We'll make sure that they get the forms filled out and are well looped in. And then another way is that you can absolutely request our family cancer support kit. If you don't have them already, you can give that to a family, and they can scan the QR code and sign up themselves. So a couple different ways. You could refer them directly. They could sign up themselves, would be 2 of the ways.
Okay. And will you be sending that out with the recording, like those links, if I don't go on it now?
Absolutely.
Okay.
Absolutely. Yep. We will send a thorough email with all of the details and the instructions, and we'll make sure that it's very clear how to refer a family. So thank you for the question.
Thank you so much. It was wonderful today.
Great. Yeah, I see a few questions. So are we able to get the notes? So we will be sharing the PDF of the presentation as well as I believe we'll definitely be sharing out the recording. So you can always reference that for review. It'll be on YouTube as well. So it can be shared and revisited as questions come up. Okay, so the question about will Pickles Jar program have children who have experienced the death of a parent mixed with children whose parent is still alive? So no, they are two separate jars, and then they're in age-based groups. So there could be a scenario where a child is in the advanced, they have a parent with advanced cancer, and their parent dies during the program, and we will work with them to figure out the right timing. We have like planned with the curriculum times when we open and shuffle the jars so that kids are getting the full arc of programming or a shorter programming. We've had that experience this year with our pilot program. It's actually been really seamless. The kids are so good at supporting each other. And many families who are facing these more complex cancer conversations are really comfortable navigating some of that complexity. So they're mostly they're in the same experience group where they would have other kids who have lost a parent to cancer or other kids who have a parent with advanced cancer. Yeah, families from Canada are more than welcome. We have had families from Canada. We've had families from Puerto Rico. We have had families from Mexico and Central America express interest. Really, the only challenge that we face sometimes is time zone, and of course, language. We are well set up to have families who are Spanish speaking be in our programs. We have a Spanish enrollment form. We have a Spanish webinar, and we do have the program is delivered in English. So for kids who speak different languages, we're not quite set up for that yet. But in terms of Canada, absolutely, we've had families from Canada. It really just comes down to time zone in terms of European countries who are expressing interest. I see there's just some familiar faces saying thank you. Do we have a PDF flyer? Yes, we do. We will include that as an attachment on the email. And I think Alana may be able to link it here, but if not, we'll definitely share that as well. And yeah, I see another question. Okay, thank you. I see someone has our information on your resource table in your lobby, so thank you for that. That is a huge help. I love on some of people I know, they'll send me a picture when they're at their own doctors and they'll be like, Pickles is here, and that just really helps people know a lot. That's the time when parents are often grabbing for those pamphlets and wanting that information. Yes, it is okay if the person in the child's life is not a parent, but a close relative. Typically, it's like a primary caregiver role. We've had a lot of kids who have maybe a different guardian, or maybe maybe there's multi-generational housing and they're living with their grandparent or an aunt or an uncle. So absolutely, we just want to make sure that their lived experience matches in a peer connection kind of way. So yeah, absolutely, we would not turn families away if they have a caregiver who they're very close with. Yeah, we would love to have you link our information, and we can definitely make sure that you're connected with Alana, our Director of Communications and Marketing. So thank you for the question. And just making sure I'm not missing anything. Okay, a question about, do you notice a difference in the grief process between kids who have watched their parents decline over time versus a loss that happened in a very short amount of time? Would they be in the same support group? So it's a good question. So we're not necessarily at the point where we can differentiate to that level. So they would be together in terms of having lost a parent to cancer. But I would say that still the honest information and coping skills can really help kids regardless of what that end of life experience looks like. When kids are prepared, we've had some of our own peer leaders have different experiences. We've had, I'm thinking of a peer leader whose dad transitioned to hospice and was at home and then transitioned to a facility and had a little bit more time. And we've also had another peer leader whose mom died more suddenly and then in a more of an ICU setting. And those kids are very close and interact and are able to share their experiences. So definitely not, a clear difference, I would say the approach would still be really helpful in terms of those honest conversations and coping skills and that peer-to-peer support. These kids, I think often adults worry more about how kids are going to be able to navigate those differences. And these kids are so remarkable at supporting one another, which is really our bread and butter, is like helping kids support each other. Um, yeah, I see the question about how to help guide a patient who's trying to decide whether they want to die at home or elsewhere, and they're worried about their child's reaction. It's such a personal decision, and one that I think requires a lot of care. Some of it is trying to figure out what that home setting looks like. I've worked with families who maybe their parent is dying at home, but maybe has a room set up where there's still some sort of um, boundary, for lack of a better word, where a kid can kind of move in and out of that space, and maybe they're going in and cuddling and reading books, but then they're also kind of living normal aspects of their life versus it being really central in the home and in constant. But I've also seen families navigate a death in the middle of the home, and it's also maybe having moments where that kiddo is able to, is going to school or going to play date, really having extra support around, maybe if there's sensitive times where it might not be as comfortable or appropriate for a child to witness aspects of end of life. And again, it's that open communication. I always work with kids on, they may, when we're really nearing end of life, they may be saying goodbye many times. And I always say those can be bonus goodbyes versus, maybe the wishing you had said something. And so that, we might be nearing that time where sharing what's important to you can be really helpful. And if you get another chance, that's a bonus chance, but you'll be glad you have had the chance to say that. So really, again, that legacy building, that memory making can be really helpful, and trying to balance that. Sometimes there's mixed opinions within a family about what's best for a child. And so, of course, it reminds me, it's not the exact same, but it kind of reminds me of when parents are trying to decide, whether to wear a wig or to shave their head. And maybe their kid doesn't feel comfortable seeing them bald, but maybe the parent really is not comfortable in a wig. And it's like, you have to also figure out that loved one's dignity and what really matters to them. And that can help with decision making, is, what is the non-negotiable and what are the values that are kind of driving the decision. But I would say if a parent is feeling like a parent dying at home is going to be too scary for kids, I would argue that with adequate preparation and support in place, kids can navigate a death at home if that's the parent's wishes. It looks like Alana was able to link the program flyer. So thank you for that. And then also connecting with the organization wanting to share information on your website. I think I got to all of the questions, but we do have a few more minutes. So if there's anything that I missed, please don't be shy. I'm trying to make sure I don't miss anything. And if not, feel free to drop. I know many of you are probably joining on your workday or multitasking. And so, of course, want you to have a few extra minutes to maybe take a drink of water or whatever you need. I know this is a sensitive topic as well. So thank you. Thank you for your partnership. Thank you for your support, your engagement, and for supporting these families every day in different settings, because they're better for it, and wanting to help them.